The arrival of COVID-19 vaccine in the country on 3rd March brought about a sense of hope for the state after barely a year living in the dark shadow pandemic of corona. Kenya makes us the first East African nation in receiving the Oxford AstraZeneca vaccine after the government brought the 1 million dosage. After the President Uhuru Kenyatta flagged off the dispatch of the vaccine, recently, Mombasa got its first consignment of 9,000 dosage today at the Coast General Hospital, while preparations of the health workers seem to be on the progress of getting the vaccine. Questions rise concerning who would take the vaccine first and its efficacy before being injected to Kenyans. Pauline Aginga, Chief Officer for Public Health in Mombasa, advised the whole practice to be voluntary. As a leader, she led by example and got administered with the vaccine.
AstraZeneca, the reason why it's being prepared for the country ni kwa sababu inaweza wekwa mahali other vaccines are being kept. It can withstand the environment, the weather that we have. So it doesn't need special storage facility other than what we have. That's the beautiful part of AstraZeneca. So we are optimistic that being a county that has been maintaining cold chain, our healthcare workers are very particular about maintaining cold chain. We'll do the same with this one and make sure that by the end of the day, we get a potent vaccine for our staff.
She further explains the security measures before giving the vaccine to the rightful person.
For our healthcare workers, I think wale walikuja hapo awali waliona vile the registration exercise inafanyika. So it's a quite vigorous exercise. It doesn't a screening before registration exercise. So we are going to work hand in hand with the disciplinary force. And when I say disciplinary force, the county commissioner must come on board to help us identify the security personnel for us to ensure that it is so tight. We are not allowing people from outside to get the vaccines, those who are not qualified to get the vaccination. But on the question on other facilities, just like my colleague has said before, tumeanza na Coast General leo, but we are going to scale it out to other roll it out in other facilities, sub-county facilities, because we have level 4 healthcare services. So basically, if you look at the model of vaccination, we are supposed to do it in level 5 and level 4 so far, according to government protocol. So our other healthcare facilities like Chuda, Likoni, Portrees, and we'll identify a facility in Kisauni that can roll out the vaccination exercise for our healthcare workers and other essential service personnel.
Challenges are bound to be there in health and all facilities. She gives the numbers of COVID-19 cases.
Tumefika karibu 9,000 kwa samples zaidi ya 1,100 na tunaendelea kuongeza kupima. Tulilegea kidogo tu manake we ran out of reagents. But saa hizi tunaanza na tunashukuru kabisa county leadership. We've been able to mingle. At times tunashindwa mali pa kupeleka, but we created a very good relationship with the Cambridge Welcome Trust Kilifi. Wakati tumelemewa huku Coast General, we ask for more slots na wanatupimia. Mostly tumekuwa tukipata so many tests for travelers na contact tracing kwa community. So for travelers, you know, it's very strict. It should be within 72 hours. So when we run out of reagents, it affects the turnaround time for our travelers. But we've tried as a county, I may say, we've done our best to make sure that we deliver.
Finally, Mombasa County gets the vaccine of COVID-19 virus, well known as AstraZeneca, and hope resides to the numbers of people who would come for the vaccination here in Coast General. Reporting for Al Shifar TV, I'm Dalila Hamza.